Being that we're on the subject of cosmetics, I have a 7-year-old daughter, and she fell one time and got hurt, and she cried really hard, and it seemed like blood vessels in her face burst and left these like little red dots all over her face. Is that something that you treat or that you see often, and how long can those last? I've seen hers last up to like 4 days or something, but it was always a worry.
If they persist, yes, we can treat them. Again, with the vein go. We don't see them all that much, but we do see them. I will tell you that spider veins can occur anywhere there's repeated trauma. So we treated ex-football players that get helmet trauma on their temples, and they'll have a bunch of spider veins right in front of their ear.
Yeah, I've seen that.
We treated cheerleaders that years ago people were standing on their back, and that repeated trauma causes a bunch of spider veins in the back. So spider veins, we see spider veins along the bra line, because the repeated friction from bra straps can cause spider veins. So anywhere there's repeated trauma, we treated children that had trauma to the face, and it left them a little spider vein, bothers mom. So we can get rid of those. Yeah.
My mom had a condition, I remember, where she would bruise very easily. I mean, some is just a slight, punch in the shoulder would cause a bruise, and which is then bleeding, beneath the skin. Can any of your treatments work with, like, not necessarily that condition, but removing a bruise or the blood that builds up underneath the skin like that?
The quick answer is no. There are some patients who have this rusty discoloration below the knees. In the front of their legs, around the ankles, and that very often is a sign of vein disease. That may be the only sign, and sometimes that can be related to repeated bleeding under the skin. It's really the iron in the blood that stains the skin this rusty color, but no, we can't get rid of
the buildup, the bruises or anything. There's no quick treatment. I'm just wondering, in case of a cosmetic situation, maybe you got an appearance and you wear a sleeveless dress and you want to get rid of a bit unsightly bruise or something.
And elderly people that have, it looks like that red hole of blood underneath their skin. Is that something that you can treat?
Purpura. Purpura. No, not really. That's not an uncommon thing. People on blood thinners, or just as we age and our skin gets kind of paper thin, that kind of thing. But when we see rusty discoloration in the legs, it's almost always a sign of undiagnosed, untreated vein disease. It can be very subtle. And so we'll have people come in with great-looking legs except for a little bit of rusty discoloration. They'll have multiple symptoms. We'll lay an ultrasound on them, and they'll have a big problem.